Good morning, good evening, good night. We are here on the morning show. We have Abby in the house, as usual, representing the UK.
Look, trouble now. Keep jumping up. Oh, there you see it. This morning show thing, only bringing bad news. Abby, how you doing, man?
I'm good.
It's
good,
evening,
thanks.
it's afternoon. Where's the exact time?
Afternoon.
Where's the time? So, Chica, over here with all these people today. Get over here today.
We have real
Talk about
things.
it.
So, this week we had the Form 4s to 6s going back out to school, vaccinated and unvaccinated students. And of course, the news reporters hit it Monday morning, bright and early, to catch the happenings.
All right.
Yes.
We go touch that.
I'm not very happy about it. They have vaccinated and unvaccinated children going to school together, which is ridiculous. I know of 3 people already that have been double vaccinated and they have gotten the COVID. So I am worried for my child. I am desperately worried for my child. And if anything happens to her, I am going to sue the ministry because this is ridiculous and it is careless.
What school is this?
I can't do that.
First day at the school today.
Very good, very good.
After all that time away from school, how you feel the child? How was
Well,
it?
my daughter, she remained excellent to a point, and it's good. Happy to come back out to school.
You are worried about the vaccinated and unvaccinated ones?
Well, yes, to a point, but eventually we have to move on. Vaccinated or not vaccinated, we have to move on.
You're not scared at all.
No, look, I am San Fernando East Secondary, and I'm going to face that problem with this morning too.
All right, so
Wow.
2 different views. One planning to sue the Ministry of Education if anything happened to her child, and the next man, he normal. What do you mean? We have to move forward. Yes, so this morning the question is, are we moving forward or backward? Because we have some other clips to show you where it will seem as if we are moving backward. But then we are seeing things being put in place so that we can move forward. It's like a tug of war right now, I will say.
Yeah. I agree.
It's really, really like a tug of war. Good morning, Sonali.
Finale.
It's really, really like a tug of war because we know that there are parents who are not comfortable with having their child or children go back out to school, whether they are vaccinated or not. Then there are some who can't wait to just send all the children back to school because it's real pressure home. They're seeing what the teacher is going through and they don't even have the whole class to work with. So you can it has some really looking forward where they could just send, some people see school as like a daycare sometimes and not really a place of learning. It's just where they can just put their children and they get a break from them. And then, everybody have a different, as a parent, having the children out there.
If this lady have money to sue the government, you choose to send your child to school. You cannot keep your child home, right? So the government is responsible.
I don't know.
You pack the bag, you put on the uniform, you drop her off, and then I sue the government if anything happens.
Yeah.
Wow, I don't think we understand. I don't know. But we have some positive parents.
Yes, you definitely do.
So you're gonna take it, daddy, you know, to mommy, daddy. So you're gonna take it some of the, Abby, how you feeling about this?
Ah, I mean,
How you
I'm
feeling?
going with the flow. I'm going with the flow, but I'm all right.
So what you
Yes.
think about the vaccinated and the unvaccinated now
Um, if the
that
policy was
allowing
only,
putting mask up and stuff, you know?
I'm a bit confused because in the beginning, why only vaccinated allowed to go to school,
Hmm.
and then
Well, now
the
everybody
the,
could go,
the
now everybody is allowed now, so everybody have a chance at
why?
these ministers and these government people, they change they turn on a dime, Because first they
Yeah,
were saying that they're not gonna have any mandatory anything, and then we see it all over the world. You know, it-
mandatory.
what the government do? They sit and they debate and they argue, and then they come to some kind of content. I wonder when I'm gonna be seeing Abby and these videos here, these sweaty Sundays. I can't wait.
I would try and prepare myself. Not
Hello, yeah, daddy.
promising.
Yeah. Let me take you to body I like these.
Tell me your name, please.
My name is Jairam Siram.
Mr. Siam, how do you feel about your daughter coming back out to school today?
Well, I feel good,
Are you
very good.
are you comfortable with the protocols that were put in place, and have you spoken to your daughter about what to do while she's at school?
Yes, I keep reminding her of all these things, and I mean, we have to try. We know the situation, not only in our own country, but in the world. And while all is happening, we have to continue life. We have to try to fit in life within everything else. So I am pleased that school is reopening back to accommodate all the children. And so.
Think positive thinking. Positive thinking. Yeah, so this man, he cool, he calm, he quiet, he feeling good, very good about his child, having the opportunity now to go back out to school. And as I said, we have to get back to some kind of normalcy. We have to, whatever
Yeah.
is happening around us, we shouldn't let it affect, our normal lives or whatever it is we do. It shouldn't affect the things that we do so much so that we thinking that we can't do it anymore, or we just focus on COVID and
Yeah.
having to get vaccinated, or if it is you're going to get the virus and all of these things. So that was, a very positive outlook there on the whole situation.
Notice the male generation is being very calm, and the females are.
Hey, last week we did not have a calm meal. We had a man saying everybody should come out. We didn't have a man that was calm last.
You are interested enough when the man say, my daughter to do she love. They let go everybody.
Yeah. Let go everybody.
Very interesting. Because the fellas, you notice when man talk, when the man them get bad, the woman and them all they could talk. But when them fellas start to come out, let me change the room. So we going through it. We're going through mother concern. So we have concerned mothers. Let's put it like this. We have concerned mothers and fathers who fed up to their children inside you. Yes, sir.
Good morning. My name is Lorraine Rajkumar. I'm overwhelmed that my daughter is coming back to school this morning because of the pandemic and the cases that we are having in the country and stuff. But more or less, I am happy too, in a other sense, that she's coming back to school and getting back, to her schoolwork and stuff.
And how do you feel about the protocols in the school, and also what conversation did you have with your daughter about keeping herself safe while at school?
Okay, I am not too keen on certain things. For instance, the amount of students in the class. I don't know yet how many, but I heard that everybody has to be together, vaccinated or not. And of course, I try to educate her every way that I could about safety, social distancing, touching, handling of desk and stuff, washroom, everything, I tried my best to. And I hope she follow now that she's in school with her friends and stuff.
Yes. So, I mean, she's concerned that the vax and the unvax are mixing. Her daughter is vaccinated, but she's still concerned because there are persons who are vaccinated who are contracting the COVID-19 virus. But it doesn't mean to say that they are going to get severely ill. It doesn't mean to say that they are going to die or anything like that. Right? And I think that's the purpose of the vaccine. So your body will recognize it and it will be able to fight it off. So I know persons who were fully vaccinated and did get COVID. Right? And they were fine. They showed they were asymptomatic. So it's not like, the person lying down in bed in pain, they have high fever or anything like that. Right? So, I mean, it all depends on how it is you decide to look at life. It all depends on your thoughts. And for me, like, if you have positive thoughts, more positive things will come to you. Rather than if you're thinking negative, then, you're negative all the time. Something always happening for whatever reason. Yeah, that's how I just see it.
True.
So, you want to really try to think as positively as possible all of the times if we can. Of course, we're going to have some thoughts. I wonder if it is, oh God, I hope I'm safe. I hope the children safe or whatever. Because, persons, they may go out, they say they are following all the protocols of washing their hands. They're making sure they wipe the desk. They might be they're not even using public transport. But the thing about it is that everybody goes to the grocery. So at some point, some persons, they might try to get deliveries. They might do the curbside pickup because they have that they call the grocery or the text, whatever grocery list they have, the packet up, everything ready, and all they have to do is now collect it. But it's still coming in contact. So there is some people, of course, it's spraying down the sanitizing all the groceries, the packaging,
But
everything.
there's some, and
Yeah, that's some. But some persons say they did all of that. They are going through all of that. And yet still they got COVID-19. Right? But you can get it anywhere.
In the reality of this situation is that you cannot. It's an invisible enemy. Yeah, you're taking precautions, but it's a bacteria. You know how I don't think it's a
like it's not like a person you can see that they wanna
something so minute that you're wiping down, you're saying, come on. If the study measles has been in the atmosphere 4 hours after the post and measles left, it's like it's a bacteria, it's a virus. There's a virus, and that is the tricky thing. But where we are opening up and certain places opening up with caution and school, there are places in the world lockdown, and it have a lot of deaths in Europe and Moscow. You know what I mean? So whereas all people are aiming and going to school and we so get nicer. Where do we? Nice man, that's the do man, glue man. And have big first world countries that catching the skid now because it's not looking good.
Vaccine hesitancy and all of these things happening.
What's going on in Europe right now? Let me touch Europe.
The global number of reported cases and deaths from COVID-19 is now increasing for the first time in 2 months, driven by an ongoing rise in Europe that outweighs declines in other regions.
Another reminder, the WHO's Director General saying Thursday that the global pandemic is far from over. Big jumps out of Eastern Europe, out of Russia, where vaccination rates are low and where new rules, some the toughest in well over a year, are rolling out. Moscow now entering a new lockdown with stores, restaurants and schools closing. Only essential shops are staying open. And on Saturday, a nationwide workplace shutdown begins in a bid to curb infections as Russia continues to report record daily deaths and cases. This Russian funeral workers representative says with so many COVID deaths, his industry is overwhelmed. We can't put 2 coffins in 1 car, he adds. Many Russians are reluctant to roll up their sleeves for the country's own Sputnik V COVID vaccine. Some point to distrust of authorities. Others are concerned about the safety of the shot. Only about 1/3 of the country's population is fully vaccinated. On Thursday, Ukraine announcing a new lockdown for its capital, just as the country reports an all-time high for daily cases. And now Ukrainian police are cracking down on fake vaccine certificates. Officials releasing this footage showing officers raiding a doctor's office that's allegedly involved in a booming black market of forged proof of shots. The government has made vaccines mandatory for some state employees. In Ukraine, only 16% of the adult population is fully vaccinated. The country is experiencing some of the highest death rates from COVID-19 in the world, and hospitals are strained. Hungary now introducing vaccine mandates for more workers as the virus surges. Where the vaccine rates are high, the country's prime minister says the number of hospitalizations and deaths is low. The lower the vaccination rate is, the more tragic the situation is. Last week, Latvia became the first country to reimpose a lockdown in Europe's new COVID wave to tackle an outbreak in one of the least vaccinated EU nations. Melissa Duggan, City News.
Wow.
So, see, it's Moscow, it's Ukraine. Yeah, so, I mean, it's not just one country. Even last month, Jamaica as well, they had lockdowns too. You know?
Wow.
So, yeah, Sonali, and people here complaining, we good over here, you know. When you look at these other countries, be real good over here. Be real good.
Wow. Definitely.
So,
I'm surprised about the doctor's office.
Well, I'm now going to ask you that. What it was about that? That seemed like it had an action in between the news there, where you know you see them actually banging down that door to get in and just take all the computers and
I'm a bit confused. I mean, if the certificate or passport, whatever, is authentic but yet still fake, how do they know? That's what confusing. How does it link to him?
Well, I guess based on whatever investigations that they did, it would have been linked to him. They may have been monitoring. Okay, these are the group of people, and they you know how they do the investigation, and if you look at the crime mysteries and all of that, you see it have a series of investigations in order to get to that.
Them is old thieves.
Yeah, black market.
In Chile, we go call them old thieves. If you're not taking no vaccine, don't take nothing. Don't go and look for no fake thing. Don't fake nothing. If you're taking nothing, stand your ground. You understand? We understand your stance. We respect your stance. As I said before, you might have a word of the shit coming up. So you don't see that. Right? It's your right as a citizen of the world. We understand that. Stand your ground. Don't tell me you ain't taking nothing. And then you're going looking for fake things. Come now, man. And these doctors, and I just want these doctors should be supposed to
the money.
Yeah, it's
the money, innit?
Yeah. So let's see these big countries, boy. See Ukraine, man.
Yeah.
This is very interesting. We need to show this because we need to show it because that people could actually see what's going on. And the next thing up for bat, all the preschoolers and the daycares, children under the age of?
Well, it's 5 to 11. Yeah.
5 to 11, we coming again. So we're going to take a look at what is up
the
next.
The numbers keep going down.
Yeah, don't worry. The children who are going to preschools and primary schools, They're coming for again.
So they're right here, so you stay very loose.
American kids could be rolling up their sleeves for their first doses of the Pfizer COVID-19 vaccine as early as next month.
It's entirely possible, if not very likely, that vaccines will be available for children from 5 to 11 within the first week or two of November.
The Food and Drug Administration's advisory committee is set to vote Tuesday on whether to recommend the pediatric shot, but the Centers for Disease Control will make the final decision. Its own panel of vaccine experts will meet November 2nd and 3rd, and Dr. Anthony Fauci expects a thumbs up.
If you look at the data that's been made public and announced by the company, the data look good.
Pfizer says its kid-sized vaccine, seen here, is more than 90% effective at preventing symptomatic infection. At the same time, U.S. health regulators say the vaccine's benefit for preventing hospitalizations and death outweigh any serious possible side effects. The FDA says it weighed the risk of myocarditis, a type of heart inflammation that occasionally occurs in vaccinated children, but concluded the danger of COVID is greater. The regulators wrote, the overall analysis predicted that the numbers of clinically significant COVID-19 related outcomes prevented would clearly outweigh the numbers of vaccine-associated excess myocarditis cases. The latest data from the American Academy of Pediatrics shows about 131,000 kids tested positive during the second week of October alone. That's about a quarter of all COVID cases in the U.S. It is the sixth consecutive weekly decrease from the pandemic high of nearly 250,000 cases in early September. But the organization says 131,000 cases remains an extremely high number of newly diagnosed children. Even when vaccinations in youngsters begin, the CDC director says masks will still be recommended.
In my mind, the most important thing right now, as we work to get our cases down, as we work to get our children vaccinated, is that we continue the masking to keep our kids in school.
Karen Ciolin, City News.
So, well, you see the color, so it shouldn't have no mix-up because the labeling on the kids vaccine is yellow and the adults, their labeling is blue and white. So it's color-coded. So, you know, yes, we know because the nurses and doctors, they are really burnt out. And it have persons where they say it had cases of, you know, mixing up the vaccines to give the wrong second dose and those type of things. But with this Pfizer, I mean, it shouldn't have a mix-up because it's color-coded. Unless they're really relevant. And I think for nurses and doctors who are really, I really believe that they should get some, even if it means a week off, just to catch back themselves. Or if they just feel that they need how much of they need to get that, you know, because it's really hard out there. And I mean, it's really putting a strain on the healthcare system when it is, you know, now, like here in Trinidad and Tobago, they are saying that the doctors, they have to like play God in a sense because they have to choose who get beds. This week it had the ICU, all beds are filled. There are no more beds in the ICU, right? So, I mean, the cases, because last week, I mean, when they decided to let the Form 4s to 6s go back out to school, they said they look at these COVID-19 number cases, all of these things. But then, I mean, in this week you are here and you know the cases are going up, persons are in ICU. Wow. So it is really, I mean, some people are questioning what's really happening. And hence the reason, are we moving forward or backward, right? So it is very, you know, it's have a lot of things that people are really questioning right now. But as we see, it's not only here in Trinidad and Tobago, it's all over the world, these things are happening. So one moment you are seeing the cases going, it's decreasing, people opening back up, businesses, people getting to go and enjoy themselves. So this coming Monday, restaurants can serve alcohol. You know, alcohol is being served. You know, the dining is real. You can knock a glass.
Abby, I'm sorry for them. But I am sorry. I want to see Friday night how it go. I feel like I go on the road with the camera and see if we can. to see these places that way. Gotta feel like I do a little Friday Night Live in our bar.
Wow, that would be
Real talk live in
interesting.
a lounge. Yeah, because it's, you know, we could do that when they're with the curfew. That could be madness. But the
Yeah.
curfew still
Oh,
there. The curfew still
Yeah,
there.
well, we don't know. We have to see what's happening today. If we have any news conference saying they're going to lift that curfew.
If they lift the curfew, pandemonium. Literally.
pandemonium.
Yeah,
Yeah,
literally. I shudder to think.
literally.
Yeah. That's what's going on. So, as we going through the vibrations, so let's see the children. I'll be always a view on the children vaccination. I know I'll be there. And
I
that.
don't like the
And
idea
I
for the
attack. Let me get it.
5-year-old kids. I don't like the idea of the 5-year-old kids. I mean, they'd say at the beginning that the kids wasn't badly affected, even though they can still spread it. But if the
Yeah.
kids not getting, if they ain't getting badly sick, like proper sick, then why do they need to be vaccinated? We're supposed to protect ourselves from them because
To
they
me, it's
don't
a
get sick,
ticklish
but
thing,
they
no?
can spread it.
Because we don't know. There are some children who immune system compromised and they're not as healthy as others. So now to try
Yeah.
to weigh, yes, we know to say a blanket statement like children immune systems are, you know, it's kind of hard because there's a case by case on the immune system, you know, how, you know what I mean? Who,
Okay.
which percentage strong enough to just go normal and which percentage not strong enough, you know, to, you know,
Yeah.
it's hard because we could say children on a whole, but then we have some children immune systems are working properly
That
and then it has
compromise.
some who not. So to
Yeah.
know,
Fair
we
enough.
can't say that. We can't say that. That is like hard to do. So it's hard to
Okay.
make a judgment. I wouldn't want to be in any kind of ministerial because
Hmm.
he said nobody. Yeah?
Yeah,
This will,
you can't please everybody.
you will please some and then some will have but yeah, but you don't have the yeah, but you will keep
Yeah.
getting yeah, but so you can't please everybody. So that is the hardest thing I think in this whole scenario when coming to this child and children and vaccinate and unvaccinate. It is
Well, I
hard.
mean, it's all on record
Yeah.
at the
Yeah.
hospitals, at the GPs. It's all on record which child has,
Yeah.
compromised immune system and stuff. So I think if they
But
did targeted,
I didn't think everybody they would know. Like you see, it might have an average information on the child's health, but then you wouldn't know for sure. You wouldn't know if that variant is the thing that might throw off this particular
Yeah.
child opposed to
Exactly.
another particular child. So
Or
it's
even
hard.
with the new
wow,
It's
variants,
hard.
how it will affect children on a
It's
whole.
hard. That come like a diet. That come like certain diets we might use for certain people, and then it have certain people. You know,
That's not going to
you
work for
can't
them.
generalize it. It's personalized. You know, and trying to personalize a virus. You can't, you know, they might just the
Yeah.
vaccine, maybe they would say, and that would be the reality for them and those. And this is what, well, we're seeing that in the big countries, the people who are not vaccinated, what is happening. So I mean, we
Yeah.
can take into consideration this piece of information as well. So, you know, we're skeptical, but we're watching what's happening, and we can know that, you know, hey, something will be okay here, something will be wrong here, and then we can make proper decisions on the scenario.
Yeah.
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 Let me
But
see
we
the
really
staff
don't
and
want to go back
mandatory
into
for
a
staff.
lockdown now.
The mandatory for staff right now. It's about bacchanal. Let me touch
Good
this
evening.
bacchanal,
Some news
please.
tonight from the TTC that could affect your commute for the rest of the year. Melissa Nikovely has more on the Transit Commission, saying there will likely be some delays down the line.
You could see delays on the TTC starting next month. The company says they're expecting a worker shortage as they roll out the next phase of their mandatory COVID-19 vaccine policy. So how could that affect riders? The company says they're working out those details right now.
We've had to plan for scheduled service that imagines fewer bus operators in November than we have today.
It's a realistic problem the TTC is preparing for as they wait for the remainder of their staff to disclose their vaccination status.
Several weeks in advance of November 21st, we have to plan for schedules that envision a different workforce than we have today. So that's really what we're doing. But that doesn't mean that, you'll see wholesale service changes across the board.
Officials with the TTC say there is potential that the next 2 months they'll be faced with fewer TTC workers, including drivers. That could cause service delays across the city. But the company says high traffic routes like Wilson, Jane, Eglinton, Finch, and Lawrence East will not be impacted.
We've really made sure that we're protecting those areas and those routes and those corridors that have the most traffic at the busiest times of day.
But where you could see changes, less traveled routes during off-peak hours, such as the 97 Young Bus. The TTC says they'll also be putting a stop to weekend and evening closures for now.
The finer details are being worked out now, and then by November 21st, we'll have those schedules ready for people to look at. So they'll have their predictable service. They'll know when their buses are going to be there, but we may have more. We may have additional people that, as of today, are not vaccinated, but on November 21st, they will be.
Right now, 88% of TTC workers are fully vaccinated, but officials say they're still waiting to hear from about 1,000 employees. As for riders, some say they don't mind a minor disruption, as long as safety remains a priority.
I'm not too concerned. People have a freedom of choice. They can do what they like. But yeah, I mean, if that's the case, I'll wake up 5 minutes earlier. I'm not too worried.
I think we would rather want them to be vaccinated because it's safe, and I think it's mandatory that we have it.
I'm concerned for other people who may not be able to get a vaccine. So I think exposing to people like that is not a wise thing.
The union representing transit workers says mandatory vaccinations in this manner may not be the right way to go. In a statement, they say in part, the TTC opted to bulldoze their mandatory disclosure policy through, causing a potential staff shortage. Instead of cutting service, the TTC should look at sensible alternatives that help protect workers and riders, such as regular testing for the small number of members who wish not to receive the vaccine. Employees who are not vaccinated or have not shared their vaccination status by the end of the day on November 20th will be placed on an unpaid leave until they show proof that they've received both doses. Melissa Nakavali, City News.
Yes. Imagine 20%, so they say 80% is vaccinated. 20% that's not vaccinated is actually 1,000 workers. That's a lot to know. That's a lot. It really is. So you can imagine, and then if it is they don't say what their vaccination status is, or let's say that they are not vaccinated, they're going to be home with no pay. I mean, that's what a lot of, companies are doing now. You're going to be home with no pay because you choose not to be vaccinated. And until you go out there to get your vaccine, well, you receive no pay. So it's very, I think we know that will apply for those who will be able to take the vaccine and not those who are unable to take the vaccine for whatever medical reason. Because there are people we know that will not be able to take the vaccine. Right? But if you don't have a valid reason for not taking the vaccine, you will have to stay home without pay. And that is the reality of the situation.
Abby, what's your view? Abby, what's your view, girl?
I mean, the woman did say everyone have their choices. And if the vaccinated already know that they're protected, and people still decide not to get vaccinated, then it's all, it's on them, I guess. It's on them. So why is everyone, so why everybody's fussing?
Me fussing. Right now, I'm fussing for next visa because I see the Tyrell walk out.
I mean, if they don't want to protect themselves and die, that's on them. Why is it a big deal?
Chica.
Well, as I said, that's a lot of people to be home without pay, right? And I mean, you have to really seek the best interest, not only of yourself, but of your family and your children, especially if you have children. Right? Because whatever you do affects your children. It's not just you alone. You're not single, and it's you alone, and whatever it is you do, you do. You're always gonna affect those around you. You're gonna affect them. And I think that people have to remember that it's not just about you. It's about the people that you say you love, the people that you say you care about. What about them?
True.
It is. Like, come on, let's make the right decision. But I wonder that the lady who says she will get up if she have to get up 5 minutes earlier. How much difference? How much difference it will make?
But I
If it
don't know
is she
if the
doesn't get
time
it,
zone.
but she said
I
no,
don't
she
know if
said
the
she was gonna
time
get up
zone in
5 minutes earlier,
I don't know if the
right?
time zone in that country. 5 minutes is I don't know. The
5
daylight
minutes
saving.
earlier. I don't know how it's working out because some people they may wake up and it will take them more than 5 minutes just to roll off their bed. 5 minutes earlier ain't gonna make no difference unless when they're out there because 5 minutes now it all depends on 5 minutes. 5 minutes can make a difference, but it depends on what it is.
Hour earlier, baby.
But not 5 minutes because
you transit time, you want to get ahead of your
exactly,
transit. An hour,
exactly.
5 minutes in your jet. We already know
You
that
and
can
I
fly
go.
way too fast.
Because if it is, I kind of like if I'm traveling and I know a certain time you'll meet up, these set up like a group of maxis. If it is you 5 minutes late or even 1 minute, you're going to miss. You have to wait a whole however long again until
Like
our
there's an
next
hour,
group of
an hour
maxis.
earlier
So
would
it
be.
can't be 5.
Yeah. An hour earlier for transit and commute and bus and train, you get that early. An hour before everybody else, not 5 minutes. So,
5 minutes.
Yeah, crazy. So we are later. Hey, move with over Giselle. Obviously, you spoke to Giselle.
I haven't spoken to her
Giselle
for a
looking like
few
she creep
days.
out that life, I have to call Giselle.
Just I'm
Just looking like a
partying.
creep. She looked like she creep outside.
I don't
As
know.
soon as she started to feel better, she started creep.
Yeah.
She's gone. Yeah, she's a bit better.
Yeah, she creeping. I will deal with her.
Yes, it could be more easy. It may be different. It might be better. But I just thinking, I'll get enough 5 minutes earlier.
Yeah.
That is not really much time, no? 5 minutes.
It went.
Yeah.
Well. So what going on later? Let's stop me from starting my
So
bacchanal last night. The bacchanal was going
we
well.
did not stop you. We just said let's leave it for another day.
Yes.
How much bacchanal we go have in one night?
Hey, I'm saying. I'm gonna roll it.
And you were quite a rule.
Have you started to open up?
You were quite a rule. So
I
you
see
only
that
have what is cooking.
So tomorrow, I see that in the morning, buddy.
In the morning, probably. Since you are
Probably.
so
Let me tell you. So
lion.
here, that's our next thing we have to talk about. Words people use, and it really means I'm not coming. Yeah.
You got yourself turned in on the inside. So this is what we have in the morning. This is what we have in the morning. If you're looking at the screen, Abby is saying.
Probably.
All the days what we have. We have certain
Words like probably
big
means
up
that I'm not showing up.
Big up so all they not waking up. We just know they don't waking up people. All they don't getting up off on their bed. Big up so
Clyde.
Yeah, you just know the late risers on a Saturday. Jeez. Yeah, we a long time the truth. Long time. We learn. I wonder if it has been following along in the sweaty Sunday with Chica boy. You all could follow along.
We learn long time and jump out yourself,
Yeah, well, you can follow along on Facebook because the ladies rule this platform at this point. Yeah, the ladies rule this section. Yeah. Have you had to come and punch your short pants? It's sweaty Sunday here.
I am an introvert.
Yeah. It's sweaty Sunday, so make it shine whole laugh rig day. Looking nice. Sweaty Sunday.
I will
yeah,
probably
Christmas things start. Chica and work, so
we learn working. Oh no.
Sweaty Sundays, the day by the game, we have Baccarat later.
Yes. And then the effects of COVID-19 at 5:30, how it has affected person's self-esteem. Yeah? Self-esteem.
Yeah, self-esteem. I mean, we are the same other self-esteem, isn't it? I see that a lot of ladies have self-esteem issues. All this sucking fat and putting it in places.
I don't know
And
about
if
that.
you love yourself without the fat day, you ain't gonna love it with the fat day, no. You just become a pin-up girl. Yeah. Yeah. So we can leave, right? We can leave all we can roll up. All in late, all is now gay enough and want to play all that messaging the other side. Right? Only late risers.
Yeah,
But
late risers.
morning. So yes, we do your working Wayland, but they can follow along in the morning with Chica, and we hear now that this girl next to
Abby
me.
will probably join us in the morning.
Probably.
Abby.
Oh, yes, lion.
It is something really though. I feel like I get takeout.
Probably.
That probably
Yes.
yes. Like,
What's it called? We're gonna, yes, we're gonna.
Maybe Abby joining us in the morning for 20 Sunday.
There's a probability, and it
That
can
I
be low.
will be.
Abby, moral support. You can come and shake your waist. You have to remember it's ladies supporting ladies.
Okay, all right. I get
You
it.
understand it? We try to get back that girl power that used to be look at that's the early women. We'll not watch out these ladies here each other.
Yeah.
Yeah, man. We try to get the ladies to, stop bad talk, man, a little bit and do something else. Do something. You can be good.
Yes, we go. So we'll see you for what they're cooking. And in the confessions and everything, people will confess what words they use to mean that they are not coming.
So it's confessions for what you're cooking.
Yes.
So I started off with I must confess. And whatever else you want to put in the reality. I think about that would be real funny,
Why you say that?
Because we started off with I must confess. That whatever. I wanted to kill my co-worker.
Oh no.
It's how some people have some real gruesome stuff.
I must confess that, this skill is a trick, not a treat. Keep it with the Halloween theme, Because we had a confess, but this is going to be interesting. I must confess.
I think so.
It's something like
right. Listen, there's a must that we don't have to.
I must confess that, it have things you could share,
Yeah, it have things. So think about those things.
The darkest stuff you had, so you can place,
I will really have to think about that. What I will be able to put out there. Yeah.
I must confess. I like that. Abby?
Well, I am waiting for your confession.
I must confess, this one is liming right now. Oh, recovering from the lime.
Recovering, yes.
I'm called to the skin. Where we got from here, but we got up another